What is a nasogastric tube? A nasogastric tube is a thin and flexible tube that goes in the nose and down into the stomach. It is used to give your care recipient oral nutritional supplements or milk and medications when they are unable to consume by mouth. To ensure that your care recipient's nasogastric tube is working well and does not need to be unnecessarily replaced, it needs to be taken care of every day. In this video, you will learn to do the following. 1. Perform oral and nasal care for your care recipient. 2. Secure the nasogastric tube in place. 3. Prevent nasal pressure injury. 4. Prevent tube blockages. Next, let us look at how to perform oral and nasal care. The nasogastric tube may make it harder to keep your care recipient's mouth and nose clean. If it is not kept clean, it could lead to health issues such as infections, bad breath, crusting and bleeding. Here is a list of things to take note of to improve your care recipient's oral and nasal hygiene. 1. If your care recipient cannot perform his or her own hygiene care, you will need to help them. The cleaning process may be uncomfortable, but it should not hurt. It is important to explain what you are doing to reduce struggling, which may result in your care recipient accidentally pulling out the nasogastric tube. 2. Before you start the cleaning process, ensure that the nasogastric tube is secured in place. 3. Wash your hands with soap and dry them thoroughly. 4. To maintain oral hygiene, you may continue to use a toothbrush if your care recipient is able to. Alternatively, you may use an oral hygiene swab. Squeeze the swab to remove excess water. Gently brush the tongue, inside of the cheeks, and teeth. Make sure to use a circular motion while cleaning. 5. When cleaning your care recipient's nose, take a moistened cotton swab and gently swirl it around inside each nostril. When removing the plaster, take note of the marking tape on the tube. Remember where it is, so you can put the new plaster in the same place as the old one. Use a wet face towel to clean your care recipient's nose and the tube. Ensure that all the required items are within your reach before changing the plaster. Once the nose is cleaned, tape the new plaster over the nose and wrap it around the tube to hold it in place. You should change the plaster at least once a day, or when it starts to come loose or gets dirty. Ensure that the tube is secured firmly, but not too tight to cause discomfort. Avoid overtaping the nasogastric tube, as this can cause skin irritation, nasal pressure injury, or make it hard to check the tube. The tube can put pressure on the skin around the nostrils, which can lead to nasal pressure injury. To prevent this, follow the securement instructions as mentioned earlier, and regularly check the skin around the nostrils. If a nasal pressure injury develops, please contact your community healthcare provider. The nasogastric tube has a small opening at the end that lets fluids or medications flow into the stomach. It is important to keep this opening clear, so that milk and medications can be delivered to your care recipient. Sometimes, the tube can get blocked because it was not flushed well, or the tube is bent, or there are leftover medications or milk stuck inside. Here is how you can prevent a nasogastric tube from getting blocked. 1. Make sure to flush the tube with water, before and after giving milk and medications, to prevent any leftovers from getting stuck in the tube. 2. Make sure to prepare and give medications as instructed, to prevent the tube from getting blocked and to make sure the medications work well. 3. Use the correct feeding formula as prescribed by your doctor. If you need to add protein powder to the milk, make sure they are completely dissolved before feeding. If there are clumps of powdered formula, you may use a sieve to remove them before feeding your care recipient. If you encounter tube blockage, please refer to the video on troubleshooting common nasogastric tube feeding issues. If the tube is still blocked, please contact your community healthcare provider for help. If your care recipient needs to use a nasogastric tube for a long time, your community healthcare provider will replace the tube to make sure it works well and to lower the chances of nasal pressure injury or infections. The frequency of tube replacement should follow the tube manufacturer's instructions. Thank you for watching this video.